Ahead and get started. Welcome to the CARES Act Steering Committee. There's Dr. Bledsoe right now. Thank you. Welcome, Dr. Bledsoe and Senator Wallace. Great. So we'll get our meeting started today. Thank y'all for joining us. We have a short time frame today and a number of things to take care of. So first, I was going to see, I'd like to call the meeting to order and ask if you have received the minutes, if anyone had any changes or corrections to the minutes of last meeting from September the 9th.
I move we approve the minutes.
Second.
Motion to approve and second.
Second.
Second by Representative Allen. All those in favor, please signify by saying aye.
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 Thank you. Any opposed? No. Okay, the minutes have been approved, and I appreciate it. We do have a full, all of our steering committee members are present. We do have JR in for Secretary Cook. Otherwise, all the other members are present today. So the first item on our agenda today is from the Department of Finance and Administration. It's a follow-up from our last meeting where we looked at the cities and counties request, and we have a pre-approved project recommendation list, as well as an additional piece of information related to Treasury guidance and all of that. So I think Secretary Walther, you have a full room, and I believe Paul Lothian also has some information. So I'll pass it over to you.
Thank you, Secretary Smith. I appreciate that. Since the last meeting, we've been, Paul Lothian and his team have been working along with CTEH to develop this additional list for the cities and counties. And so I'd like for Paul to make any comments with regard to it, and then we'll answer any questions that the committee may have.
As I alluded to in the last meeting, we have worked with CTEC and Hagerty to develop this pre-approved or the potential pre-approved list of projects that you have the Secretary Smith sent out. The whole concept here is designed to make it as easy as possible for the cities and the counties to bring up in the portal, to bring up one of these projects, click on it, and it will be pre-filled out with a lot of information for them that they can look at, review. If they need to make a change to make it more specific to them, but still stay hopefully within the realm of things that we can say, yes, it fits the program as it's defined. They simply have to upload their documentation, make the dollar request, certify that it's exact, true, and meets the qualifications of the program, and submit that, and be able to then have that reviewed by either a DFA staff member or a CTEC staff member, approve it, and push it through for payment in a relatively short period of time. It would still, well, with one exception I want to talk about in a minute, I think this would still need to be at the $50,000 level for pre-approval. If it's more than that, we would still send it on through the workflow to the steering committee for their review and approval, even though it meets this criteria. If we have 8 or 10 of them in that time period that say is $100,000 to $125,000, we would try to bundle those together, make a recommendation for all of them at one time, and ask for y'all to review them and approve those, much like is done in the legislature when they bundle up like request and approve those. The caveat to that is the reimbursement for the city jailers, EMTs, whoever that happens to be, those first responders, the public health and safety individuals. New guidance came out yesterday that said, we're not going to make you show us the documentation that qualifies these individuals. There's a series of questions that y'all were given, and it basically says if you say that that's what they were doing and that's inside the public health and safety arena, then the presumption is that they were doing that and we're going to allow those expenses. You simply have to back it up with duty rosters, payroll records showing that person was paid for how much, and that will be the extent of the documentation that's necessary. You won't have to provide an analysis for each individual, how you determine they were substantially engaged or not, which is kind of tracked from the start where they said they're going to do this. They gave us a little looser guidance, and now my feeling is they've opened this up to say, if you have public health and safety employees and you're paying them during this time period to work with the public, we are going to pay you for that expense.
Paul, is that straight time?
That's straight time. If there's overtime involved, we still need to run that through as a request from FEMA to get any kind of overtime back from the FEMA filing that would go through Adam. But having said that, what we'd like to do is have approval for those items that are listed like 3A through 3B or C or D on that paperwork. We would like to have pre-approval for those to batch those, whatever level they may be. Send those through as a one-time request every week, 2 weeks, whatever we get those in, and have y'all look at those and approve those as a bundle also. I'd be happy to answer any questions.
Thank you. So the first, I think your first request was related to, if y'all have the spreadsheet that we emailed, that I emailed around, the items 3, 3A, 3B, and 3C are listed as labor for COVID-19 responders, time unaffiliated with FEMA for public safety workers, jailers, dispatchers, and parole officers. And if anybody has any questions, let's cover that first. If anybody has any questions on the request related to that, it's my understanding that what you're requesting is anything that falls in these 4 categories could be pre-approved by DFNA, even if it exceeds the $50,000 level, and we wouldn't have to see it back at the CARES Act steering committee as long as it falls into those 4 categories. Is that correct?
Yes.
Okay, so does anybody have any questions about that, or do we want to have a motion related to that?
This is Senator Irvin. I'll make a motion that we approve the recommendation by DFNA.
Thank you, Senator Irvin. Is there a second?
Second.
Thank you. Was that Dr. Bledsoe or Senator Wallace? No.
Me.
Senator Wallace?
I think it was Lane.
Oh. Either one. Okay.
It was.
Thank you. Second by Representative Jean. Any questions regarding that motion? Okay. All those in favor, please signify by saying aye.
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 And a lot of you are waving your hands. Any opposed? No. Okay, thank you. No opposed. So that motion has passed, and we will allow for the items for labor related to COVID responders for public safety workers, jailers, dispatchers, and parole officers to be pre-approved through DFNA. Then Paul has explained the rest of the list. You guys have had, the committee members have had the opportunity to review it. Do you have any questions? Do you want to have any discussion on that? Or would you like to have a motion related to that? And I think what we've talked about is anything under the threshold of $50,000 would not need to come back to the CARES Act steering committee. If it fell within the other items, 1 and 2, 4 through 8. Any questions or discussion?
Then may I make a motion that we accept the DFA proposal on those other items?
Yes. Motion by Secretary Walter. Is there a second?
Second, Senator Urban.
Thank you, Senator Urban. Any questions or discussion? All those in favor of the motion for approval signify by saying aye.
Aye.
Any opposed? Thank you. The motion has passed. Okay, I appreciate that. That was easy. We didn't have any. We have Mark Hayes and Mr. Valens here from Municipal League and the counties. We didn't have any questions for you, and I know you will continue working with DFNA for training. Good job with the counties and cities, and I know y'all have agreed to reach out to all the counties and all of the cities. There was some discussion in ALC last week regarding making sure that any of the cities that you haven't heard from, you want to make sure those are reached, all the counties are reached, so that they have the opportunity to apply for these funds. Thank you very much. We now have two proposals that will assist in taking care of a lot of the needs that have been brought up from the cities and counties related to food insecurity and housing insecurity. It's 4:12, so we do have a little bit more time than I thought. I had asked them to be very limited in their comments. But I do appreciate Senator Bond and Representative Collins for bringing the Housing Stabilization Program to us. If you would like to go ahead and tell us a little bit about that, and then we'll let everybody ask questions. And again, committee, we have agreed we are not going to be voting on approval of funds in this meeting today, but I wanted the opportunity for y'all to do this presentation today and allow the cities and counties to hear about this. It could assist them, and it's possible too that some of their funds could be utilized in either of these proposals if they would so desire. So go ahead, Senator Bond.
Well, let me just say that Representative Collins has done, along with others, has done a ton of work on this, but he's been the lead, so I'm going to let him take the lead. The idea is with the increased federal length of the federal moratorium, we're going to have this sort of bubble out there where people could be very behind on their rent come January. The idea started that we piggyback on an existing program as opposed to starting a new bureaucracy. And so I'll let Representative Collins take it from there.
Okay, thanks. Yeah, I think that's about it. That's the issue, is that we have people struggling to make rent, and we have landlords who are struggling to get revenue that they need to survive in this period when we have a federal moratorium on evictions. On top of that, when the moratorium ends in January, there's concern about a wave of evictions that'll lead to public health as well as economic and social problems. So the proposal is to add to what we have been doing with the community action agencies, which, for those who don't know, community action agencies cover every county in the state. And we have, through the CARES Act, $13 million already that is out to the community action agencies to help people on things besides just rent, food being one, and other social needs. Just a small portion of that is going to rent. And the amount that's available is set by the community action agency, but it's just too low. And the threshold is 125% of the federal poverty line, which is also just too low for it to really make the kind of impact that we believe is needed to stem the problems that renters landlords are facing. So the proposal is $10 million, which would be just for rent assistance. It would be paid to the landlord, and it would use all of the safeguards and processes that the community action agencies have already put in place. So they're ready to go. We have Terry Bearden from the Association of Community Action Agencies. If questions come up, she'd be able to answer them. But the thought is that by raising the eligibility level from 125% of federal poverty to 200, you're going to capture some of those people who are still working poor, some of the middle class people. I mean, for an individual, that's still $25,000 or so. So it's a pretty low level, but it does capture more people. And to change the amount of rent assistance available from what's been averaging around $500, $600 to 2.5 times what is either the lower of their actual rent or market rent. And market rent is something that's set by HUD and is widely available. So, and then the third piece is to make sure that we're publicizing the program and getting word out to people who need it, both renters and landlords, since again, both are really benefiting. We have run this through the Realtors Association. They are supportive, they're fully in, and we've reached out to the Landlord Association, the smaller group, and we're waiting to hear back. But I think the idea here is pretty sound. It's something that renters and landlords can both benefit from, and it's a real, it's an issue. It's something that's going to be an increasing issue as this $300 extra unemployment is only week to week. And when that goes away and when the moratorium ends, I think we're going to see a lot of what we're expecting.
Thank you so much. Does anyone have any questions regarding this proposal for housing stabilization?
This is Michelle. I do.
Hi, Representative Gray, please go ahead.
Hey, thank you. Just my question was, when we're looking at income levels, or if our constituents, if they're getting unemployment, does that count into their income?
I'll let Terry answer that if Terry, you would like to answer that.
Sure. Yes, that is part of our policies within the community action agencies, that unemployment benefits are monthly countable income.
Okay, thank you.
Mm-hmm.
Thank you. Thank you, Ms. Bearden, for being here to help answer questions. Does anyone else have questions? Speak up, committee.
This is Senator Irvin. Just
Go ahead.
quick question. To be able to change that from 125% to 200%, is there any problem that we're going to find? That's set at the federal level. Are we going to have a problem being able to do that at the state level, or is that something that we set at the state level?
So actually, the 200 was for the 13 million in CSBG money that was going to the community action agencies. The CARES Act let states do 200 or 125 or others. We did 125, but this is not going to be changing it from 125 to 200. It's going to be supplementing with additional funds. So these funds will not be encumbered by the same CSBG requirements.
Okay, thank you.
Thank you. That's helpful.
Madam Chair.
Yes, go ahead, Secretary Gillespie.
Hi, I just wanted to let the steering committee know that we met today with Senator Bond and Representative Collins and with the association, and our team at DCO that oversees CSBG and works with the community action agencies will be meeting with Terry Bearden and her group over the next couple of days to do some additional work around the technical parts of doing a proposal like this.
Thank you. So potentially this could come through DHS.
That's one of the potential opportunities, yes. And so we're going to work together to see if we can work through some of the technical details involved in doing that.
Thank you. Appreciate that, Secretary Gillespie. Any other questions?
I'm hoping to finally get into Secretary Gillespie's office and write all over that whiteboard that you've got. That's my big goal.
Oh, you're welcome to come over. I would love that.
Good. I can't wait to see it. Any other questions? Okay. Representative Allen, do you have any questions regarding the housing stabilization?
No, let me unmute.
Uh-oh, we lost you. Hold on. Representative Allen, you're on mute. We can't hear you.
Can you hear me?
Oh, now we can hear you. Go ahead.
No, I don't have any questions. I just want to say that I feel that this is a great proposal, and I'm in full support of it.
Thank you. Very good. Any other questions? Looks like Senator Wallace is flying the friendly skies. That might just be the picture from his camera. Okay. Do you have any questions, Senator Wallace? Nope. Okay, good. Thank you. Thank y'all very much for bringing this proposal to us. We also have a request from the Hunger Relief Alliance. And Kathy Webb is here to speak with us today. I'll go ahead and turn my mic off and turn it over to you. Thank you.
Thank you, Secretary Smith and members of the committee. It's a pleasure to be here today, and I appreciate this opportunity. The Arkansas Hunger Relief Alliance is the only statewide anti-hunger organization. We represent the 6 Feeding America food banks. We represent over 400 food pantries and soup kitchens, and individuals, businesses, and school districts that are committed to fighting hunger in Arkansas. This year, I had hoped to come to folks in the legislature and in different state departments to tell you that for the first time since the recession, we had dropped to pre-recession levels of hunger, which we did briefly, but unfortunately, when the pandemic hit, we started to see an immediate increase in the number of Arkansans who are suffering from food insecurity. We have 6 Feeding America food banks that cover all of our counties and that are located in different parts of the state. And while I'm going to go into a little bit more detail in a moment about that data, they are seeing increases in distribution from between 24% and over 100%. They are seeing first-time users of the Food Assistance Charitable Network from between 20% and 50%. A lot of those first-time users are people like a senior, I'm going to call Bob. Bob lost his job early in the pandemic. He's a veteran. He's a senior. He worked as a custodian. He was embarrassed to call. He called our SNAP hotline, and he had never asked for assistance. And he told us as soon as he got back on his feet, he would want to pay back whatever assistance we were able to provide. And of course, that's not how SNAP works, but Bob is one of thousands of Arkansans who've worked hard all their lives, young couples who are just starting out, now struggling to access food. So what really do those percentages of increase mean in terms of numbers and in terms of people? The situation, as you can imagine, is fluid, and the numbers changed, just like my proposal changed from the time I originally submitted it to yesterday. I can tell you that one of the last reports I got from Feeding America pre-pandemic said that about 520,000 Arkansans, 520,000 struggled with food insecurity. That's 17%. And then when we look at kids, we look at the Department of Education website, and it said for the last school year in K through 12, 60% of the students enrolled were eligible for free and reduced meals. That's over 280,000 kids. Just based on information provided to Feeding America since the pandemic started, we estimate that food insecurity rates in Arkansas will increase to over 23% for adults. Would take us to almost 700,000, and that the number of kids would go up by over 65,000. That means we'd have almost 1 in 3 kids struggling with food insecurity. And that's where we were at the height of the recession. The Hunger Relief Alliance and all of the organizations with whom we work are appreciative of the work that Congress has done. We work closely with members of our delegation and their staff. And we regularly speak to many of you about waivers, about PEBT, about programs like TFAP, Farmers to Families, SNAP. We appreciate the support that the governor and in particular Secretaries Gillespie, Key, and Ward have done in pursuing waivers that have been helpful to us in so many ways. But I also want to stress that the need is great and the food that the food banks and pantries get constantly has to be replenished, and that a lot of the reimbursement money for which food banks have applied is specifically related to particular programs, and that money has been committed, the work has been done, the food banks are waiting on the reimbursements. The Northeast Arkansas Food Bank serves Mississippi County, which is the county where I was born. That county and that food bank is seeing a 24% increase in distribution since last year. Harvest Regional Food Bank in Texarkana serves Miller, Columbia, and other counties in the southwest part of the state. They have distributed 108% more pounds year to date than they did last year. The Arkansas Food Bank is the largest food bank. They serve 33 counties. And I want to tell you that during the flood of 2019, they had 1 month where they served distributed almost 3 million pounds. But since the pandemic hit, they've had 2 months where they served over 3.4 million pounds, and 1 month in July where they served 4.2 million pounds of food. The North Central Food Bank serves Baxter, Sharp, Stone, Izard, and other North Central counties. 6 of the last 9 months have seen record distributions for them. I mentioned early on that first-time users are up dramatically. In Harvest Regional area, they report that 50% of those who are coming are first-time users. The Northeast Arkansas Food Bank reports that 20% of their users are new. And in Northwest Arkansas, they report that 33% are new. The need is great. The request I've made is just under $2 million. And as one legislator and I were talking the other day, I wish I had asked for a higher amount. But in the proposal, we talk about 3 particular needs. The first being canned goods. And we already administer a program called the State Food Purchasing Program that was started after the passage of the tobacco tax. Without getting into the weeds too much, a lot of the food that we've been getting has been produce. It has been from trade mitigation, which expires in December, and we have a great need for canned goods. We know that we pay approximately $20,000 for a truckload of canned vegetables or canned fruits, depending on the specific item. And we know that with the request that I made to you, I can probably get over 1 million meals with that request for the canned goods. We're competing with food banks and associations across the United States. The woman who sources food for the food banks in Arkansas for the Hunger Relief Alliance has sourced food for a number of years and is very, very good at that. She sources the food that we currently get from the State Food Purchasing Program. And distributing all of this food, which is the second portion of our proposal, it also takes a lot of resources. I alluded to that earlier when I mentioned the reimbursement that that food banks get for commodities, which has been covered in two of the proposals that Congress, or two of the acts that Congress has passed. But we have been spending a lot of money at the food bank level for storage, for drivers, for diesel. And as one example, the food bank of Northeast Arkansas is spending about $4,500 a month in unbudgeted cost for reefer trailers and diesels. Pantries across the state always struggle with refrigeration and shelving. Pantries always need help. And I never am able to provide enough grants to pantries to meet their needs. The Alliance has been blessed this year with over $330,000 in sub-grants. But I want to tell you that we've had, for those two grants, we had $965,000 in requests. That's almost 3 times the need that we were able to provide. Those things are refrigerators, freezers, shelving, all sorts of things like that. And we're very good stewards of the money. I've worked with a number of you, and I hope that you have confidence in our ability to be good stewards of the money. When we get a grant request, for example, for a refrigerator or a freezer, we don't automatically give it. We look to see how much food that pantry distributes, how often they distribute the food. We often recommend a smaller or a less expensive refrigerator or a freezer. There are no Viking refrigerators or appliances. There are no expensive items like that on that we provide money for. Our third request was for meat protein. And I've had to change this portion of the request more than the other for 2 reasons. 1, because of the changing market, and 2, because of the time frame which we will have if we are fortunate enough to receive a grant to fulfill the requirements of the proposal. We know that while protein comes in a variety of ways, we know of seniors who split pills in order to buy ground beef once every few weeks, which they stretch out and put in spaghetti just for that extra protein. But with the shortage of processors and the shorter deadline, I tweaked the request to allow us to buy a combination of protein, which we still believe we could get approximately 997,000 servings. In good conscience, I have to tell you that what I saw yesterday in the market that was available might not be exactly the same a week from today, and that slots and beef processors can't be held very long. But I am confident that I can fulfill the terms of the CARES Act. Finally, we put a small amount in the proposal to cover administrative cost that would make sure that I can keep any commitment I make to you all and to the state. The staff I included in this proposal does not include any of my time, anything I've done or will do. It includes food sourcing, accounting, and membership, which deals with sub-grants. The administrative costs I included was a modest 3.8%. As I mentioned, I would have loved to have asked for additional money. I believe with the demand, I could justify that. And I hope that you heard from the increases that the food banks are seeing from all corners of the state, the central part of the state, that the gravity of this situation is clear. For Bob, for the senior who splits her pills, for the kids who need food to learn, for the woman who lost her EBT card and whose house I went to yesterday to take her $50 to buy groceries. I am here today as the voice for all of those and thousands of others across the state. I humbly ask for your consideration and will try to answer any questions you might have. Thank you, Secretary Smith.
Thank you so much, Kathy. I appreciate that. And I hope you know that we have allocated funds for meat processors to comply with the USDA requirements and become certified. And Secretary West Ward is working on that, and they have those requests in process, and they've actually had more requests than they have allotted dollars for. So hopefully that will be assisting in this process soon. So with that, does anyone have any questions for Ms. Webb?
Hi, this is.
You want to send
Go
it
ahead.
Irvin first, and then we'll get Cindy Gillespie? Okay.
Go ahead, Kathy. Go ahead, Kathy.
And
Go ahead,
I
Kathy.
apologize, there's a slight delay. I just wanted to say that we were aware of that, the beef processing issue, and we have also been talking to one of the legislators who is going to introduce a bill in the session next year regarding beef processing.
So, hi, this is Senator Irvin. And just along those lines, I saw what other states had done in the meat processing. So I went to West Ward about that. And I would just ask Secretary Smith if we do have additional requests, or I think that we're at 9.2 million, it could be more in additional requests above the 5 million that we approved, that we get a report from Secretary Ward about that, so that we can perhaps look at making a decision if we want to support that more or not. And the reason why is exactly what Ms. Webb spoke very articulately about, is they are backed up. I mean, there's a year-long wait in some of these meat processors. And so they really need, we are so inadequately served in this arena with meat processing capabilities in the state of Arkansas. So, you know, it's a long lasting effect, but just to what Kathy spoke about is the fact that you don't have the protein out there that we can distribute. And we do that through Hunters Feeding the Hungry, and hopefully everybody will go shoot an extra deer this year and donate it. But we also have to have the meat processors to be able to handle that program as well. So my request would be that we get a report back from Secretary Ward as well when we're bringing all these back for consideration. Thanks. Thank you, Kathy.
Thanks.
Thank you. I'll ask for that. Thank you. Secretary Gillespie, did you have a question?
Mute. Sorry about that. Okay. Yes. First, let me just comment, Kathy. I've told you this before. The work you and the Hunger Alliance do is really amazing. Y'all do a tremendous job. I thought it might be helpful for the committee just to, as she's been talking about the increased demand and what's going out, just something that helped me get a little bit of perspective about what's been going on in Arkansas. In a normal year, we here at DHS, the commodities flow through us and then out to the food banks and pantries. In a normal year, we get 28 in 6 months. We'll get about 28 truckloads in semi trucks in and distribute them out. It's about 1 million pounds and about $1 million. In the first 6 months of this year, we did 271 semi truckloads, over 10 million pounds, over $12 million worth. Okay, so the amount of food coming in, commodities coming in and going out to those pantries because of trade mitigation and COVID has been enormous. And as she said, then they are having to, on their end, work with all of that and get it out to a public that very much needs it. So it's just to give you an idea of the scale and the massive increase. I mean, that included 38 semi-trucks that other states could not accept, you know, and we were able to accept them in here into Arkansas and get those out. So there's a massive increase in food flow, but at the same time, as she said, there is a massive increase in the need and demand that's going on at the other side. And so for my question, Kathy, just one thing, if you wouldn't mind addressing it for the committee, because this went through the legislature, and I know you'll get asked the question. And you semi-answered it, but I just want to give you a chance to fully answer it. And the last round of commodities distribution money out of the CARES Act, there was $1.5 million in administrative funds that went out in order to support some of the same types of activities, storage, et cetera. And could you just comment on why additional is needed on top of that?
Yes, and thank you for asking that. And also, Jim Ponzini is amazing. So thank you he does great work, and we are very appreciative of the work that he does. This ask is very different from the distribution and storage money that was included, the TFAP money. And I've got a lot of papers here, and I may not be able to find the right paper. I believe that in Arkansas, that food banks were allocated something like $3 million in storage and distribution costs specifically for commodities distribution. The food banks have applied for those reimbursements. That's for commodities that have gone out. They have not, those reimbursements are pending. But my proposal to you today basically looks to the future and food that we need to get in that will replace commodities, it will replace trade mitigation food, and it will also be more canned food and protein as opposed to produce, which is what a lot of the TFAP food has been. I hope that answered that question, Secretary Gillespie.
It did. Thank you.
And I've got that specific number, but I'm not sure which piece of paper it's on, but it was 3 million something.
Thank you so much. Does anyone else have any other questions? Two pieces that I just wanted to clarify is one, the number, while you say future, it's the short-term future. It's a lot of need right now, and this goes through the end of December, which would comply with the CARES Act requirements. And then also, when you talk about the capacity building grants for food banks and pantries, you're not actually building facilities, but it's increasing the ability to allow the pantries to have the needs, to have the food and the products to get to the recipients right now.
That is correct. And because of the deadline of December 31st, that's why I had to tweak some of the proposal yesterday. So I apologize for that some of those last minute changes, but yes, that is correct.
That's fine. And Representative Allen has a question. I'm trying to make sure I get it unmuted. There you are. Go ahead.
Thank you, Madam Secretary. I just have a comment. Kathy, it's obvious that you're running a great program and you're doing an outstanding job. And I want you to know that I appreciate what you're doing. You mentioned earlier that with this request, you will be able to feed 1 million people. And you also mentioned earlier, if you had the opportunity to get more money, it would be helpful. And this is one of the reasons why you amended your proposal to ask for a little bit more, so you can, because the demand is there and you want to meet the needs of the people. So I just want to say that I appreciate what you're doing, but I want to ask the question to make sure that we're on the same page. With this proposal, you said 1 million meals will be distributed. Is that correct?
I said that with the initial part of the proposal, which was the canned goods part of the proposal, I expected to be able to purchase about 1.5 million pounds of food, which is the equivalent to 1 million meals. And then with the protein portion of it, I expect to be able to purchase approximately 997,000 of protein. And as I also mentioned, the market changes daily, and we look daily at what's available, both in terms of truckloads of canned produce, what's available in terms of ground beef or chicken or tuna, all of those different things. And those prices change daily, but this was the most up-to-date pricing that I could provide for today.
Okay. Thank you for your answer, and thank you for doing an outstanding job.
Thank you, Representative.
Thank you. Does anyone else? Yes, go ahead, please.
Melissa Lane, how you doing?
Good, how are you?
I'm still watching you on cable TV, just to let you know. I'm looking at this. Is this a $2 million grant?
It was 1.976. It was $2 million, and I tweaked it yesterday in my tweaking to 1.97, I think.
Okay. Is this guy, when I'm looking at this capacity building grant of 965,000?
You know,
we're not dealing with that, are we?
We've got, and I believe that you got my original proposal from July, and my proposal from yesterday is, I think.
So there's another proposal that I hadn't printed out yet. Okay.
You've got a state food purchasing, you've got $800,000 in state food purchasing. The total is 1.976.
1.976. Okay.
Yes, sir.
All right. We all do a fantastic job.
Thank you, Representative.
Thank you, Representative Jean. They did reduce the capacity building grant request to 600,000 from that original amount that you saw.
Okay.
That was a discussion from current budget chair to former budget chair. You know, sometimes I think we forget historically that Kathy was a budget chair in the legislature. It hadn't been that long ago. So thank you, Kathy, and thanks to the Food Alliance. Of course, we love it here, and it has a statewide impact.
Thank you, my senator.
Does anyone else have questions or comments? We're going to actually end the meeting early.
Many members talk about a lot more stuff if you want to.
Oftentimes we go over in time.
You may be by yourself.
Thank you so much. Does somebody have another question for Ms. Webb? No. Okay. Thank you so much, Kathy, to you and to Senator Bond and Representative Collins, to the Municipal League, Ms. Bearden from the Housing Stabilization request. Also, thank you to DFNA for all the work that you have done working with the cities and counties. And thanks to the committee. I appreciate all your hard work. Does anyone have anything for the good of the committee, for the good of the order? Any questions? I think I have a couple of pieces of homework. One, I'm going to get with Secretary Ward regarding the meat processing. And
Elizabeth, this is Michelle. Thank you. Just a quick question. I know let me take my mask off. In our last meeting, we were talking about like the mobile testing units.
Yeah.
And we kind of asked Dr. Romero to go back and look to see how much, they had already spent on testing, and if they had any monies available to put towards that, to kind of come back to us. Do you know where we are in that process, and if they plan to come back to us maybe at the next meeting?
Yes, they do. And as one of the things about today's meeting is we are looking at where we are with the return funding. So that's why we didn't really bring any up for request. I
Yes.
think that, what was it called? The Health Equity Response Team with those mobile health units, they are looking at that to make sure that they will be able to provide the need. I know there's a great need for the mobile units to go around Arkansas, so they are going to be presenting that request.
Okay, thank you.
Thank you. Is there anything else? Any other questions y'all have? Anything you need from me? Okay. Well, thank you so much. I appreciate it. And y'all have a good evening. Thank you all for your time. We'll see you later.
Thank you.
Thank you.